We now turn to a concerning development in the Democratic Republic of Congo, where a mystery disease has claimed the lives of at least 60 people. With symptoms ranging from fever to bloody vomit, health officials are racing to identify the cause. Joining us is Dr. Hannah-Lisa Tetteh, a medical doctor based in Accra, Ghana, to discuss this outbreak. Dr. Tetteh, good to speak to you. Appreciate you joining us. Now, can you describe the symptoms of this mystery disease and how is it spreading?
Okay, thank you so much for having me. So I must note that this is a mysterious disease because they don't really know what the disease is so far. Investigations show that they don't really know what the disease is. But the symptoms people are presenting with, and of course the most alarming is the fact that the onset is, the death after onset is 48 hours. And so that's what is really alarming. But then people are presenting with diarrhea, vomiting, abdominal pain. Some people have stiff neck, and then others are coughing. Then they have a fever as well. So these are the general presentations that people are coming with.
Dr. Tetteh, we understand that the first three victims were 3 children, and they ate the carcass of a bat, from what I understand. Now, is this a delicacy in those parts, or does it speak to other issues such as hunger that may have resulted in these young children eating this carcass?
So I think that both factors can be accounted for. There are certain places that eat things that generally people don't eat. But then considering where the outbreak is located, most people are saying that it's a very poor state, and it could also be as a result of hunger and inadequacy of food. And so that could be the reason for which they are eating the bats.
So let's talk about the challenges that health officials are facing in responding to this outbreak, particularly because this area, as you say, is remote.
Yes. So there will be challenges, of course. If we can draw some lessons from COVID, we can know that initially there's a lot of misinformation and then there's a lot of fear and panic. So that's the first challenge everybody needs to deal with. Now, everybody's looking up to the officials. What are you doing? What is happening? And then the officials come out and say, we're not really sure what it is. We're trying to see if it is this or that. There are reports saying that it's from the bats. There are reports saying that it's from a poisoned water source. So it's just the general fear and panic. Now, how would they even take the information you bring to them? Because you're not even sure yourself. People are not patient to wait for investigations. What has been done is that it looks similar to certain diseases because of the presentation. So that has been, investigations have been done for Ebola and Marburg. They've come out negative. So that has allayed some fears. But then it's coming from water sources in a very deprived place. What are the government officials doing? Health workers and health officials are only limited in what they can do when there are issues of social determinants of health affecting the outcome of health and then its impact as well. So are government officials, or is the government involved in how to deal with this disease? Now, what information do you even have to buttress except the fact that people are falling sick and people are dying? So the challenges are a lot, but a lot has to do with which information are you giving out, especially when you're not sure. How are we taking the information, especially when you are not sure? So I think that this is the major challenge that people are facing.
Now, the one word you don't want to hear is illness. And it's aggravated when you hear mystery illness, because it almost suggests that people don't know what is happening. So let's talk about the WHO and other global agencies. At what point do they come into trying to deal with this situation?
So they mostly come in as soon as a strange illness is reported. So first, it'll have to come from the surveillance of the country. So then when the country reports there's a strange disease, that people dying, and the case fatality ratio in this case is quite high because we've had over 50 people dying with almost 500 people infected. So we're looking at about 12%, and that's very high. So that's a public health concern. And so WHO, all the public health organizations would need to come in, especially when the case fatality ratio is high. Because we've learned a lot from COVID. One, it could just start from a small town. The next thing we know, the whole world is infected. And so they come in immediately. They hear that there's something that is killing somebody in 48 hours. It shouldn't happen. What is happening? Is this as a result of the disease? Is it the weak healthcare system? Is it the poverty in the area? So all of these things have to come in play. The tests have been done to show that they are negative for Ebola and Marburg, as I mentioned. But then WHO will also come again to come and do their own surveillance and then come and do further tests to be sure that our suspicions are not what it is. I think that even there'll be a bit more relief if we find out that the disease is something we know. Then there's an idea of how to manage it and how to contain it. But then if everything you're testing for is coming out negative, then it raises more concerns, not just with the people, but then with the health officials and then the organizations as well.
So at what point does this become an epidemic and neighboring countries and citizens of the DRC should start worrying?
So right now it's in a village, but then you don't know how it's even spread. So now there's a lot of protection of the people there and people who are coming in, because you don't want the people coming into the village to be infected and then they take it outside. You also don't, so there's been a lot of education of their family members and relatives as well. They're telling them these are presentations people are coming with. So if you see anything like that, report. It would also help to know how it is spread, whether it is infectious or whether it is actually from the water source that WHO thinks or believes it is now. So yes, there is some struggle, but I think that efforts are being put in place to ensure that it doesn't move from its locality to other parts of the country and then outside. The challenge is it could just be one person that will take it out of the country to another country, and then it becomes an epidemic. So you can't be too careful and too sure, and just do the little that you can, I believe.
Now, are you convinced that the authorities have this matter under control now, given we also need to look at potential global implications of this outbreak, especially given the cutbacks on global health funding?
So that's a major concern for most people, because the greatest donor of the WHO is out now, not giving money. Other funding has been restricted. So now WHO has to work with just a little money, and that's a challenge that everybody acknowledges. Of course, I said that it's in a very remote place. So how much is the government giving? How much money is even going to go into investigation? The good thing is that now the little lessons we've learned from COVID is that the response time is fast. So now WHO is on the ground. Surveillance has increased to ensure that it is contained. So I think that's the positive thing. So if you ask me, are the officials in charge? Yes, because now the response is fast, and then things are being done to ensure that it is contained within where it is. But as to giving information to everybody, it now has to do with research, how fast the research is, how well we are able to do our investigations and come up with responses, how responsive the people are. Because sometimes you even want to help people, but then are they responsive? Are they giving you the right information? Are they scared? What do they believe it is? So if you get to a place where they believe that it's a curse or it's a cultural effect or something, they will not give you the information that you would want. And so that could sometimes delay as well. But I think that response time has been fast. Investigations are ongoing. At least there's been exclusion of certain fears like Ebola and Marburg. And some cases have tested positive for malaria. And then investigations are going to be done again. So,
your final thoughts, Dr. Tetteh, on some of these diseases that are found, particularly in tropical countries. What work does Africa on its own need to do? I mean, when you start thinking about the funding cutbacks that we're experiencing at the moment, is the greatest indicator that Africa almost needs to wrestle the initiative and not wait necessarily for the WHO, even though many countries are a member of WHO, but almost for countries and sectors on the continent to take care of these situations around health?
I think the challenge mostly is that we don't prioritize preventive medicine. So we mostly wait for the situation to happen before we start reacting to it. And when you react to things, you always miss something. There have been a lot of lessons from COVID. We haven't worked on our health systems or our health infrastructure. There are certain places that do not have even health facilities at all. So when situations like this come, it may not even be so serious, but because they have weak healthcare systems, they are unable to manage it and effectively bring it under control without external help. Do governments prioritize health? I would say no. If you look at budgetary allocations to health, most of the time they're very, very little, a very small percentage. Some of them are even less than 10%. Meanwhile, the health of the people is very important to ensure that everything is working. So we don't prioritize health. Now, how much are we putting into research? How much are we putting into making our own medication? How much are we putting into manufacturing? How much are we putting into building research centers? I think that we need to take an approach where we learn to sustain ourselves and prioritize health, so that it's not every time that we need external help or every time that we run to people. We need to look at other sectors, try and gain money from other sectors to be able to develop strong healthcare systems, because sometimes all it takes is one pandemic. If you're looking for jobs for the people, or you're a government and you prioritize jobs alone, when you get the jobs and everybody dies and they are not able to do or they're not healthy enough to do the jobs, then you may not have achieved anything at all. So I think that we need to prioritize health.
Dr. Tetteh, speaking to us from Ghana, appreciate your time. Dr. Hannah-Lisa Tetteh, speaking to us about that mysterious outbreak in the DRC that has claimed almost 60 lives, and calling on African nations to spend more money on research and development where health is concerned. Well,